All right, thanks everybody for joining. Today we're going to be discussing how Legacy Health hires and retains permanent nurses. My name is Iman Abuzaid. I am an MD by background, and I'm the CEO and co-founder of Incredible Health. Incredible Health is the fastest growing career marketplace for permanent healthcare workers. And we are the only platform that allows hospitals to hire permanent nurses, experienced nurses in 20 days or less. We flip the script where hospitals and health systems apply to nurses instead of waiting for nurses to apply to them. So joining us today, we're very excited to have Mel Stibal from Legacy Health. She is Legacy Health Meridian Park Medical Center's Chief Operating Officer and Chief Nursing Officer. Mel also leads workforce planning for nursing for the entire Legacy Health system. Legacy Health is a locally owned nonprofit 6-hospital system that served the greater Portland, Oregon area for many years. It's also been named one of Forbes Best Large Employers, and it's one of Oregon's 5-star health systems. Mel has over 30 years of nursing experience, and she's had former leadership positions since 1995. Most recently, Mel served as Associate Chief Nursing Officer at Jackson Memorial Hospital in Miami. And prior to that, she was Division Director of Critical Care and Cardiology at Providence St. Vincent Medical Center. And now, lives in Portland, Oregon, supporting the Legacy Health team. Mel, thank you so much for being here.
Thanks. So happy to be here with you today.
Great. So we have attendees from all over the country. They include nursing leaders, HR leaders, operations leaders from hospitals and health systems from many states. This is designed to be an interactive discussion. So for everybody attending, please do feel free to submit questions and ask questions in the chat. And we'll try to answer some of them as we go along, but we certainly have a Q&A time dedicated at the end to answer your questions as well. And so what we're going to be covering today is the current state of the nurse labor market in the US, what Legacy Health does to support nurses, and both in terms of their residency programs and their training, as well as the challenge in creating more flexible schedules for them too. We'll be covering nurse hiring. We'll be covering how Incredible Health helps, and then there will certainly be a Q&A section. We're always asked if there's going to be a recording. Yes, this is being recorded, and a member of the Incredible Health team will be in touch right after this webinar to be in touch and share the webinar recording with you. All right, so let's start with our market overview. We are all operating in the US healthcare system in 2022. This is the US healthcare system has an enormous amount of demand because our population is aging. Obviously, pandemics don't help either. So the demand on the healthcare system continues to increase, but the supply of workers has not kept up with that demand, and that includes the nurses too. And every single state in this country is experiencing staffing shortages, and we do not have enough nurses to support our patients in the US today. Healthcare is the biggest labor sector in the country by number of workers. It's been the biggest employment sector in the US since 2018, and 1 in 8 Americans works in healthcare. Just to put a little more data behind what's happening nationally, and I know the numbers are similar for Oregon as well. We are in the midst of some very challenging times in US healthcare and for US nursing in particular. We are on track to be 1.1 million nurses short. We are experiencing the highest annual turnover rates among acute care nurses that we've had in the history of the US healthcare system. It's currently at 18.7%, and that's been an increase since before COVID. We're also seeing very rapid wage inflation that includes not just the temporary workers, but also the permanent nurses too. And all health system executives and leaders are expecting wage inflation to continue over the next couple of years among permanent nurses too. And labor as a percentage of revenue continues to increase. And then we're also seeing longer times to fill roles at hospitals and health systems. Right now, the national average is at 82 days. We have some health systems that are faster than that, some that are slower, but particularly for the permanent and specialized nurses, it is taking, almost 3 months to fill these roles. Mel, you say the challenge is pretty similar in terms of what you're trying to tackle in Oregon too?
It's exactly as you described it here. All the same problems are in place.
All right. So, one of the things that we do at Incredible Health is we have being a tech-enabled two-sided marketplace, we have access to just an enormous amount of data that's going through our marketplace. When nurses sign up on our platform, we are asking, what is the reason you're changing jobs or considering a new role? And so we have about 10% of the U.S. nurses on our platform, but that's about 400,000 nurses. And honestly, the reasons are the same, and they haven't actually changed. The reasons the nurses are leaving their roles hasn't changed too much as a result of COVID. By far, the number one reason why nurses are leaving is they're looking to advance their careers. That can come in various forms. They're looking to expand their skills. They're looking to specialize further. They're looking to cross-train. Some are looking to move into management. It really is a whole range of things as part of career advancement that they're looking for. The second most common reason that they are leaving is they are looking for more flexible schedules and greater, work-life balance. And that's increasingly more and more of a request among the younger nurses too, including the Gen Z and millennial nurses. The third most common reason is something to do with geography. They're looking to reduce their commute time, or they're looking to relocate. One piece of data I can share is that 1/3 of the hires that happen on the Incredible Health platform are relocating from different states. So even among the permanent nurse workforce, there is still a lot of geographic movement happening. And then the fourth most common reason is they're looking for, better compensation. Sometimes we speak with leaders that very, very much focus on the compensation piece, but the leaders that are really focusing on implementing strategies and tactics that address especially numbers 1 and 2 here, career advancement and flexible schedules, tend to be able to retain and hire more. And I know that Mel will be sharing many of her strategies and tactics for how she tackles these two areas at Legacy Health too. All right, so I'm gonna stop slides here and then open it up for discussion with Mel. So Mel, we'd love it if you could just provide even just a 30-second or 1-minute overview of Legacy Health's nurse retention strategy.
Sure. Thank you very much. Really trying to take a multimodal approach, because there's not a singular solution for this. If there was a singular solution, we wouldn't be having these calls and we wouldn't all be struggling with the same thing. I'll get into a little bit more the details with the recruitment, but some of the things that we're doing for retention especially and for recruitment, we're partnering with many, many different nursing programs on many different levels, both in clinical rotations, but also providing senior practicums and also supporting people as they go into their graduate and doctorate work, promoting them coming to us and participating. We have a residency program within Legacy. Prior to us being in our current situation with so many openings, we would graduate about 75 or 80 residents a year. This year, our program is going to graduate well over 250 residents. We have almost 300 applicants for our November residency that's coming up that we're just starting to do the interviewing process for. So really expanded that program. We've done many of the same things everybody else is doing as far as referral bonuses, retention bonuses, and trying to make things more attractive for people to stay. We've done a lot of focused work that I'll provide some detail on later about trying to take unnecessary work away from nurses so that they can do what we're designed and what we're licensed to do. And again, we did offer 2 different types of retention bonuses to our teams.
All right, great. So yeah, certainly it is multimodal, and you're utilizing several tactics. And just so the audience is aware, we will be going deep into some of these areas, particularly the training programs and the flexible schedules. So one other, before we go deeper into these areas, there's another topic that's top of mind for many nursing leaders, and that's around changing how nurses work and really taking away some non-nursing tasks off their plates. Can you just share a little bit more about how you're building this kind of support for nurses?
Sure. One of our work streams we have multiple work streams under our workforce planning, which is a larger team, but one of them is to look at our models of care. And where we want to go is creating more of a collaborative care model. We did pull a group of nurse leaders and bedside nurses together to start looking at what a nurse is doing that we don't need to be doing. And we did this evaluation, and we have a primary care model similar to what I'm sure many people on this call have. We identified 48% of the tasks that our nurses were doing on a day-to-day and are doing on a day-to-day basis don't require a nursing license at all. And so we really need to figure out how to get those tasks moved over to assistive personnel they're important tasks, they need to be done. Patients need them, but we need to have our nurses doing top of license care. Really, we want the right task done by the right person at the right time at the right level of their licensure. And we really want to try and take out we call them wonky processes. Some people call them a love triangle. I call them a death spiral. They're those processes that have developed over time that loop in nursing that don't really need to. A great example of that is your physical therapist or your rehab departments interrupt a nurse taking care of a patient to find out if the patient's ready for rehab to come. That's a death spiral to me. Or a lab gets rejected, a lab specimen gets rejected, and the lab calls the nurse to put the order back in for the phlebotomist to come redraw the lab specimen, and the phlebotomists work in the same department. So we're working on taking some of those processes out. We are looking at bringing in unlicensed personnel to help alleviate some of those tasks. And right now we're doing lots of experiments on our med surg units because those are our areas where we are seeing people want to leave the bedside, and we have probably one of our largest areas where we have openings.
Got it. And then we know many nursing leaders are considering expanding the use of LPNs. I'm curious just what your thoughts are on using LPNs.
Yeah, I was really excited about that thought as well. I actually started my nursing career as an LPN. Yeah. And so I went down that path, but in the state of Oregon and Washington, there are very few LPNs. There are only 5,000 LPNs licensed in the entire state of Oregon. That's the second lowest number of LPNs in the United States. So that's not going to be a great solution for us. We do have some LPNs that work within Legacy. Most of our LPNs work. Several of our hospitals have complex discharge units, which is another one of our multimodal strategies to try to mitigate the fact that patients have long length of stay because there's such constrained capacity within SNF and community care post-discharge. And so we do have LPNs working on those units. On average, they're taking 6 to 7 patients, and then there is a charge nurse that helps develop plans of care and the task that the LPNs can't complete.
Got it. So this has been, a very difficult time in nursing, the last couple of years in particular with the pandemic, and the role of the nursing leader is increasingly more and more important. I would love it if you could share a little more about how you think, just from a leadership standpoint, how you think about communication between nursing leaders and frontline and staff nurses, and how that's helping build a culture of retention.
Well, yeah, I agree with you. Communication is critical. People want to hear what we're doing about things. What am I as a nursing leader doing to make things better? A lot of times I have to say, I don't have the answers. We don't have the answers, but we've set up many different mechanisms to communicate at all levels within our organization. Our system chief nursing officer, Keisha Kelly, has open office hours. And at Keisha's open office hours, nurse managers and nurse leaders have a Zoom call with Keisha. She's doing it once or twice a month, so she can make the connection with that level of leadership. I meet with my nursing leadership team at least monthly. I attend bed huddles. management by wandering around, honestly, going out and answering the tough questions, talking to frontline staff, asking them how we do things. Provide me with a reality check, because sometimes I think I know how we do things, but I learn that I really don't, and they need to correct me. Meeting with charge nurses. I hold a monthly charge nurse breakfast. So all charge nurses that are available, we get online and, they pick up something from the cafe and we sit and we have an hour conversation about what's going on, what's keeping them up at night. It's staffing, and more staffing.
Yep.
And so we just look at, again, multimodal ways to communicate. We have nursing newsletters, of course, and other forums for nursing voices to be lifted.
Okay, I'd love to ask you one of the toughest questions that nursing leaders get these days. And it's how, I'm working side by side. I'm a permanent nurse. I'm working side by side with a traveler who's doing the same job, and they're getting paid 3 or 4 times more. How do you respond to a question like that?
With honesty and transparency, the reality is within our healthcare system, we have about 350, 400 travelers on any given point in time right now, which is 4 times, many more than we've ever had in the past, just like many people out there. And we've got about 4,500 nurses. We can't pay 4,500 nurses $125 an hour and keep the lights on. It's and we just have to be honest about that. And we want to do things to keep people engaged and wanting to work with us and be a healthcare system of choice, a workplace of choice. But the answer can't be $125 an hour, or, at one point at the height of this, I think our critical care and OR, we were paying upwards of $165 an hour. So we have to find ways to have our nurses stay, because this is a great place to be, and that they have a great partnership, not only on their unit, but with their leadership.
Got it. Okay. There's a couple of questions that have come in already, just regarding the topic you covered around changing the care model and changing how nurses work. One question is, from Sue. She said, we're trying to hire more assistive staff as well, but when we find them, they're not staying either, right? There's retention challenges there. Just curious if you have any thoughts on how you're tackling that.
Well, because we're doing the experiments, we are not solidly there as far as them not staying. We are having a hard time attracting and keeping our CHTs or nurse aides. There's different levels in the state of Oregon and Washington. So we're working to make them feel as important as everybody else on the team. We've developed scholarship programs to provide entry-level jobs for people who would otherwise not be able to even go to a CNA program or a CNA 2 program. We built enough flexibility in our program where the scholarships cover many different things and meets the need of the individual person, not specifically like you get this much for your tuition and books. If what you need is help getting your vaccinations, we'll figure out how to get your vaccinations. If you need help with a laptop or a stethoscope, we'll get you that. And so it's really on a very personalized basis. So far this year, we only started the program at the first of the year. We've awarded about 45 scholarships. We think by doing that, we're proving to people that we want you to be part of the legacy family and hoping you're going to stay. We're also hoping to create opportunities for people that are working in our other entry-level areas and that are uncertified CS tax, dietary, EVS, a lot of those areas, patient access, creating opportunities for them, and then hopefully we will be able to continue it through their career. We like people to identify as legacy lifers. We recognize that it is probably not very realistic, but it's an aspirational goal.
Got it. Okay. And then one more question is just how you're thinking about timelines here. Like how long are you thinking it's going to take to transform the care model or the way nurses work at Legacy?
I am hoping that we will have on MedSurg our new model in place by the fourth quarter of this year. We have done a series of experiments and iterated what it needs to look like. We will be trying to implement that, like I say, fourth quarter of this year. And hopefully we will spread to the other areas within our organization every quarter after. We have to look at different models for our specialty areas where this won't work the same: OB, OR, critical care. It's not as easy to apply the same thing there. And so what we're doing there is looking to take away barriers to practice. What are the things there that create barriers for people to practice at top of license and, be able to complete their task without those other distractions. But with the specialty needs there, it's a lot more complex.
Got it. Okay.
Focus work.
All right. Thanks, Erin, for the question. Appreciate it. All right. So let's go deep into the topic of nurse training. We mentioned earlier that looking for career advancement is the #1 reason why nurses are changing jobs. And we even have recent studies from new graduate nurses that say 55% of them are considering leaving the nursing field before retirement age. And the top 2 things they care most about is how well staffed is the unit I'm joining and what's the training, right? Can you just highlight a little bit more about your nurse residency program, which is particularly impressive, and especially how you scaled it very quickly into handling more? Would love to hear just a little bit more about that and how you're thinking about the scaling of your nurse residency programs.
Yeah, I am so impressed with what our nurse residency leaders have accomplished in the last year. So we have an 18-week dedicated program for our nurse residents that you have to apply for. And anybody with less than a year of nursing experience has to go through our residency program. That's the only way to come into Legacy as a new nurse. What we've done is we've created venues for our new nurses to be together where they're doing their didactic with our residency leads and specialists in each of those areas, and we're bringing them on in clusters to a great degree so that we can focus the teaching on what they need. And then once they go through that initial part of their residency, they go into a married state. But during the initial part of their residency, what we created were transition to practice coaches. And so we have experienced expert nurses that that we've taken away from a patient assignment that are assigned to the sweet spots somewhere between 3 to 5 new residents, dependent on the individual needs. And this transition coach has these 4 to 5 residents that they work with without a patient assignment, so they can focus 100% of their attention on supporting these residents and getting them a really solid base before they go into a married state with their preceptor, which tends to be the last 10 to 12 weeks of their training, but they're still readily available to those residents. It creates a safe place. And we're really trying to build a culture where residents feel supported and have somebody to turn to. We've had success with it. We've also had some failures. We initially thought that we could reach out to our recently retired nurses who would be really excited to come back and not take a patient load, but help support our novice nurses. That didn't pan out or prove to be true. They were really happy not being in the hospitals and retiring. So we've had to transition that out into a different manner. And we found people that were able to release a couple of days a week to do that while they still have their bedside or their other role. We've pulled from many different areas of the organization. We've had great response from both the residents and the coaches, and they've provided us feedback so that we've been able to iterate residency after residency to try to hone in on the most beneficial way to approach this. We've also found that, and I'm sure everybody else on the call is experiencing this, is that given the last 2.5 years, our new grads are not coming out with a lot of clinical time. We've had people that have hardly ever touched a patient or changed a bed with a patient in it, changed linen, those kind of things. And so the other thing that we've done in shifting our residency is we spend some time up front in the residency doing foundational skills, which helps them feel far more prepared when they hit the nursing units and they're less scared.
Got it. You touched on the topic of nurse preceptors, nurse educators. We see that in even in our marketplace at Incredible Health, these are some of the toughest roles to fill. And these are also a set of nurses that, you know, get burnt out, right? Just curious how you're thinking about just driving the retention and avoiding the burnout of your nurse preceptors, and how you're tackling that.
Thank you for that question. We're struggling with that because we have taken our residency program and, you know, morphed it to such a huge program. Our preceptors are not getting a break in between as much between residents. We're hoping the transition to practice coaches help a little bit with that and take some of the burden off. So what feedback we got initially from our preceptors were that first 6 weeks or so of precepting a new nurse, a novice nurse, was pretty tiresome because you have to teach them how to work the call lights and the beds and the IV pumps. By the time the residents are getting to the married state with their preceptors, they're actually able to function and be more helpful or productive on the units, which has been a plus. And so we've had less people stepping back from being preceptors. But we are really encouraging more people to take that role on. We are providing a differential for people for precept for all hours that they're precepting new grads. So that has helped us a bit, but we continue to struggle with it. People are wanting a break from that because it's taxing.
Yep.
So we're also trying to develop some things where we can pull people back together and give the preceptors a little bit of a break for a couple of days or a week or whatever it needs to be, depending on at what point the novice nurse is in their residency, and pull them back into with the residency leads to provide some training. It's a mess. It's hard. It's just all of this stuff is just really, really hard.
It is. Another set of asks from nurses is cross training, right? So, you know, you may already be a fully trained ED nurse, but you discover you have a passion for labor and delivery, for example, right? So I'm curious how you think about cross training and what you have put in place to support nurses with cross training.
We have a formal transition program, and they are positions. So somebody can apply for a transition position, whether it be an OB, the OR, critical care, ED, any of those areas. And so that also helps with not just bringing another experienced nurse over. We do an evaluation on where their skill set is and what they need, and try to build a program to get them to where they can be productive as far as taking a patient load. It's, again, another complex area. It tends to be about 10 to 12 weeks for OB and the OR, a little bit less for critical care, depending on the type of the critical care unit. If it's neurotrauma ICU, it's going to take longer than if it's one of our med-surg ICUs, or if it's on our ECMO unit, certainly. And so we just kind of adapt it, but they're formal positions that are a little bit protected, which helps overall, but we still have to have people to go into a married state for a portion of it, but then we're able to have them have other looping experiences with other nurses that are skilled in other areas. And we're really encouraging, if somebody, as we're doing re-recruitment discussions with people who have let us know that, hey, I may be interested in leaving the organization, we're really trying to say, hey, where else have you wanted to work? Can we find you something there? So we want to re-recruit those people. Maybe it's not going to be at my facility. Maybe you want to go to one of our different facilities. Let me help facilitate that for you. I want to keep people in the healthcare system, even if it hurts us. So really trying to be flexible there.
Got it. Okay, so then the next topic that that many leaders are trying to tackle is nurse scheduling. It is also the second most common reason why nurses are changing jobs. Just historically, but prior to the pandemic, the majority of roles that were available for nurses at hospitals were full-time roles, 3 days a week, 12-hour shifts. By far, that was the most common role that was available for acute care hospital nurses, and that's changing. And we are noticing that employers that are being more flexible and offering more options are able to hire more and are also able to retain more. I'm curious, like how are you thinking about nurse scheduling at Legacy Health?
We are trying to get to be as flexible as we can be. Historically, we've done, you need to do the 312s at 7A to 7B, 7B to 7A. And we had some pretty close guardrails about what percentage of part-time staff you should have on each unit to create the flexibility. That's kind of gone out the window. We were losing people because we wouldn't let them go part-time.
Yep.
So we were taking a risk of losing people 3 days a week because we didn't want them to go to 2 days a week. So we've kind of taken that barrier out of the way. You can go part-time if you need to. I'm probably going to negotiate the heck out of you to see how long I can get you to stay into those 3 shifts. But we're allowing people to drop their hours, their FTE hours. We're also trying to look at, do we really need to have those 12-hour shifts set up the way they are? Why can't we have an 8 to 6 shift where we've got the majority of our ADT going on? That makes sense. An 8 to 6 or an 8 to 4 makes a lot of sense for a med surg or telemetry unit. It may not make sense for other units. So we want to let the individual unit leaders identify, what does their flow look like? Where do you need the extra help? We're trying to figure out how to allow nurses to job share. That gets pretty complex. Just because of one person, you guys already know why it's complex, the whole call out, all of those issues. And we're just trying to get as flexible as we can possibly be. We also don't want to limit people to working in one area. If you come to me and say, hey, I'm really burnt out of doing what I'm doing 3 days a week. Well, I'll find you something 1 day a week in another area where we have a need to give you a break from that. And let's create a secondary job role for you, where you can go to a different area that can kind of give you that respite. So we're pretty much open to people coming and asking for what they want. And if we can do it, let's just do it. I've told all of our managers that you guys just don't lose people because we can't be flexible.
Yep. And so even though it's operationally more complicated to offer more flexibility, you're doing it anyway in the name of retention, basically, in order to retain the nurses. Okay.
We've seen our loss slow a little bit in the last 3 months. It's hard to tell if it's because we've been more flexible or the market's just shifting a little bit as the traveler market is slowing down and some other things. We still have a lot of openings. It's hard to judge where that impact is coming from.
Got it. You also at Legacy Health have an internal float pool. You even have an internal travel pool. Would you mind just sharing a little bit more about that? Why you have those strategies in place and how it's working?
Yeah, we do have, it's called our resource pool. It's similar to a travel pool, but we're only in the 2 states. So they only travel to our 6 hospitals plus our pediatric facility. Nurses are licensed in both states. And we have about 200 individuals in our resource pool, and they have their different areas of assignment. They could go to any one of 58 med-surg units if they're a med-surg nurse within Legacy, or any of our, I think we're up to about 22 different ICUs. And initially when it was developed, it was to cover LOAs and ill calls. Right now we're at the point where it's just covering our core staffing. So we are continuing to recruit into that, but it does give us a lot of flexibility. We will even move one of our resource or travel pool nurses from site to site mid-shift if a situation changes, and we have the capability to do that. They are the first to go. So you could be working in the southern portion of Portland and be pulled to go across the river to Washington mid-shift.
Got it. And that's in exchange for more pay?
They have a higher stipend, and then we do not give them a travel or mileage reimbursement, except for if we pull you in the middle of your shift and send you somewhere else, we will pay your mileage in between that.
Got it. Okay. So let's transition to the topic of nurse hiring, because you mentioned earlier lots of open roles at Legacy Health, and it's a challenging time for all employers in the country to hire nurses. How are you thinking about making Legacy Health like the employer of choice for nurses?
I think by deploying the strategies we've already talked about with the flexibility. We also, only 2 of our 6 hospitals have collective bargaining units in them, which gives us a little bit more flexibility. We are a community-based healthcare system. And so our decisions are made locally by the people who work and live in the community and who care for their neighbors, which has kind of a special feel for it. I recognize all healthcare is really local, but when your decisions are made by people who live in the community, I do think it's a differentiator. And just, the flexibility with scheduling, trying to make ourselves as available as possible to nurses at all levels of the organization, we think is really important. And really having a nursing vision that speaks to nurses, not one that, we've had one that, we've had for the last 20 years that we're updating now, because we're not the same as we were 20 years ago. Our teams are not the same. We don't do the same work. And so we're going through a visioning exercise right now with our teams to say, who do we want to be as legacy nurses? What do you want to be? What makes you stay? And so we're hoping that will make us the employer of choice, also by creating opportunities for people to advance. The beauty of being a legacy nurse is, you can go to one of 7 hospitals, and outside, there's not a service that we don't offer outside of multi-organ transplant. We do kidney transplant. So if you want to participate in a different kind of nursing, we can offer that to you.
Yep. Got it. So just a reminder to the audience, the questions are coming in, which is awesome. Please feel free to submit as many as you like. We'll make sure that there's at least 10 minutes at the end to answer questions. A lot of what we discuss today aligns, very closely with Incredible Health's mission, which is to help nurses find and do their best work. I'm just going to do a brief overview of what Incredible Health is, how we support health systems like Legacy Health and others on hiring permanent nurses, and then we'll jump into Q&A. Usually the Q&A ends up being for both of us, Mel and myself. So Incredible Health, we are a marketplace technology. We're headquartered in San Francisco, but we operate nationally. And hospitals, they use our custom matching technology to hire high quality permanent nurses in 20 days or less. They're really trying to bring their days to fill down from that 82-day average that I discussed earlier to 20 days. We're already being used by over 500 hospitals and health systems across the country. We're live in 25 states. We work with very big health systems like HCA Healthcare and Kaiser Permanente. We work with many academic medical centers like Stanford and Cedars-Sinai and Northwestern and Johns Hopkins, and lots of community hospitals as well, and local, regional health systems too. There's 3 unique things about Incredible Health. First, the employers apply to the talent instead of the other way around. As you can imagine, the nurses absolutely love that because they create a profile, they sit back and relax, they hear from different employers. The nurse gets to decide which interviews to accept and which ones to decline. And then also our proprietary algorithms we've automated large parts of screening of the nurses, as well as the matching nurses' preferences and experiences and their, hard skills to what the employers are looking for as well, and vice versa. So when say a nurse recruiter at Legacy Health logs in, not helpful to see 200 nurses like that nurse recruiter that's, tackling the ICU and the OR and the ED needs to just see those nurses that match to Legacy Health's locations and specialty areas too. We also have, a whole range of free services and tools for nurses that are built into our iOS and our Android apps. We offer free continuing education to every single nurse in the country that's accredited in all 50 states. We have salary estimators. They have free career coaching from us as well, who are also nurses employed by Incredible Health. They have access to an advice platform or a social network where they can ask each other highly specific questions. So for example, I'm looking to expand my skills in the ER. We're automatically pinging the ER nurses in our database who are coming in and answering the questions with very high quality answers. Also have lots of career resources available for nurses too. Just wanted to share a little more data with the group here. 68% of nurses are accepting the very first offer they receive. And 61% of nurses are accepting the very first offer they receive, even when the second and third offer have higher compensation. That is and we see this phenomenon happen in every location where we operate, in every city. We are finding that the hospitals and health systems that have the strongest hiring operations internally, those that are able to get nurses through their hiring processes quickly, interview quickly, get offers out quickly, have the recruiters screen, but the hiring managers interview and not have another screening done by the hiring managers. Anything that streamlines hiring operations, they hire more, even if their competition has bigger brands or if their competition has higher salaries. So this has been a big focus area for many nursing and HR leaders throughout the country today. This is just a quick case study from a team in LA. These are the different steps in the hiring process with conventional hiring versus using Incredible Health to really drive the hiring. Really where we have the biggest impact is on time to source. Recruiters and nursing leaders all over the country, one of their biggest concerns is that the applicant flow has dropped, and they're really trying to find these experienced and specialized nurses. So we really reduce that from 44 days down to 3 days. We do reduce days in later steps of the process too, through things like automatic interview scheduling, but really where we have the biggest impact is on time to source. We also track retention rates. We do retention studies throughout the country. What we're finding is that when nurses are hired through Incredible Health, the retention rate is 15% higher than the baseline. The reason for that, we believe, is because nurses were able to consider multiple opportunities, and it was a very well thought out job search before, explicitly selecting, say, Legacy Health. So it wasn't just, let me just take the first thing I can get. This is just a little bit about how we work together with different health systems. This is a true collaboration. It's a true partnership. We partner with existing internal talent acquisition teams. These are the 8 steps in the hiring process. Everybody roughly has the same 8 steps, from sourcing to screening to interviewing to getting offers out and accepted. We are supporting teams with the first 4 steps heavily. We're doing a lot of the heavy lifting and sourcing, making sure the nurses are actively looking and getting that first recruiter phone screen automatically scheduled. At that point, say the Legacy Health team is taking over and this is going into their existing hiring workflows. The hiring manager interviews are being completed, offers are sent, offers are accepted, just like their normal hiring workflows. This is a newer model in talent acquisition. I know Mel talked about ensuring that nurses are operating at the top of their license. We also need to make sure recruiters are operating at the top of their skill set too. Recruiters are very good at building relationships with hiring managers and speaking with candidates and building relationships with candidates. The more and more we can reduce the administrative work that recruiters need to do, so for example, sourcing and screening them initially, the more we're able to free up recruiter time to do what they do best, which is the relationship building with the candidates and the hiring managers. Great, so opening it up for Q&A. I know we're going to spend the next 10-15 minutes on Q&A. If anybody has additional questions afterwards, please feel free to email us, and either myself or Mel will get back to you. It's questions@incrediblehealth.com. My team will also be sending in the chat information if you wanted to sign up for a demo of Incredible Health, or if you wanted to speak with a member of our team. Awesome. So lots of questions have come through, Mel. So I'm just going to do them popcorn style. So one question that was interesting from Robin is, this is just on the topic of nurse training. You discussed nurse training, your residency programs, you discussed cross training, but I'm curious how you are thinking about refresher programs for nurses, particularly nurses who've left the bedside or they've left acute care but want to come back?
State of Oregon have requirements about refresher training for nurses that have been away from the bedside for a prescriptive period of time. And they have to go through a formalized approved program. Once they do that in Oregon, Washington doesn't have that requirement. Once they go through that program, we would put them in one of our transition roles to provide the real-time on the unit orientation.
Got it. There's a question about union. Is Legacy unionized? I think you did mention some collective bargaining earlier, but is Legacy unionized, and what impact does that have, if any?
Two of our facilities are unionized. One is our southernmost hospital in Silverton, and we acquired Silverton 5 years ago, and Oregon Nurses Association was already in place there, so that's continued. And we have a behavioral health hospital that the nurses are unionized. Outside of that, we are not. And so it does give us the ability to, in our non-unionized hospitals, it does give us the ability to, talk a little bit more freely with our nursing teams. It allows us to move more quickly when decisions are made or changes need to be made. We don't have to develop a big bargaining event where we get a lot of people around a table and beat things up. So we're able to move a little bit more swiftly. That being said, I'm not sure all my nurses would always say that we move at lightning speed, but having worked in both environments, it feels like we're able to affect change quicker.
Got it. Thank you, Eugenia, for the question. Another question from Sue that's come in is, how are you thinking about, compensation for experienced nurses that have stayed with you? You mentioned very briefly earlier retention bonuses, but curious how you're thinking about just retaining the group that's, retained and loyal.
We did a retention bonus that will get paid out over the year. So to get the full retention bonus, you have to stay in your role throughout the full year. We have an annual nursing wage evaluation, and we're undergoing that right now, where we look at, the market environment. We look at what the contracts for everybody else in our market is unionized. So we have the ability to look at their contracts to make sure that we remain competitive. It's really hard because if what we focus on is chasing the 50 cents or the dollar, we're going to spend all our time doing that versus making this an environment where a nurse wants to practice. But we go through it every single year. It's a little bit painful looking at everything. Yep. We're also looking at our differentials and how that market has changed. Do we have differentials that no longer make sense? Do we really need to focus on a larger differential for those departments that have mandatory call, because it is such a disruption in their work-life balance? We're even considering, do we try to eliminate call as much? Is it better, and do we retain our nurses more if we run a full night shift OR?
Got it. Okay. One question that came in, actually, this one's for me, from Jennifer Sotana. Jennifer, you mentioned working with Incredible Health at your previous employer, Prime Healthcare. They're actually one of our early adopters in California, which is awesome. And you're looking to use Incredible Health in Oregon, and are we live in Oregon? So Portland, Oregon is one of our newer geographies. We do work with Kaiser Permanente and Legacy Health in the Portland, Oregon area. So really just started there in the last few months and are growing our presence in Portland, Oregon. And our team's happy to chat more with you, Jennifer.
I can tell you, I know we're fairly young in our relationship, but I've had the recruiters sending me the candidates as well. Yep. That they're sending out. And we've actually been able to identify people that we wouldn't have identified before. Some of them will have to do a transition program because let's say their OR experience was 3 to 5 years ago, but that's where our need is and they're re-interested. That's a hard thing for a lot of nurses to find out there. So it has opened a few doors.
Awesome. Yeah. We really strive to bring nurse candidates that your team wouldn't normally see or normally find on their own. Great. Jeremiah has a question. What's more important in your opinion, cash or a stimulating environment with rewards and recognition? Probably all of the above.
At the end of the day, we work as nurses to be able to provide for ourselves and our families and our loved ones, however you define that. So I don't think that we can downplay cash. It will always be a huge feature or really important. But I think having an environment where you feel safe, where you feel supported, where even on the really, really bad days, you know, your team's got your back. Those things are invaluable as well. Where you feel like you're honored for what you do. I am so grateful for our team here that continue to walk through these doors every day. You guys know how hard it is out there. We're working short. Patients are different. They're sicker. They're staying longer. The anxiety because of all of the impact of the last couple of years and the environment around us, people are really on edge. We're seeing more violence. All of the legal things that are going on, especially as we look at what happened in the criminal case with the mid-air, everybody's on edge. So I try to express every single day when I encounter nurses, thank you for just being here today because you're doing really important work. It's hard. It's really hard to be us right now.
It's very hard, very hard. A question that came in from Robin is specifically about your nurse managers and supporting them. They're, Robin phrases it as, they're often invisible, but they're bearing the brunt of staffing challenges and bedside nurse burnout. And then sometimes they don't have the same incentives or financial incentives as the bedside nurses too. So like, how are you thinking about supporting your nurse managers?
Yeah, we spend a significant amount of time talking about this. And I can tell you, I have spent a lot of time peeling people off the ceiling lately that are nurse managers and assistant nurse managers because of our shortages in staffing. They're working as charge nurses, they're helping cover lunches, they're functioning as one-to-one sitters when we don't have anybody else. And so
they have to interview too.
And they have to interview, they have to be productive, stay on budget, be available to all of their shifts. So we've done things trying to allow them as much flexibility as we can, because we do also understand having a physical presence is super important. And they are so sandwiched between senior leadership and frontline staff. We have had some incentives, but you're right, not as much as we've done for frontline staff. So we're trying to build in that flexibility. We're trying to create protected time for them to do their work. Each facility, knowing what the needs are, is given the leeway to make a decision for what their nurses can and can't do. My facility, I encourage them to do a work from home day at least once a pay period. I also encourage them to take a respite day. A work from home day means I expect you to be working from home and readily available, but your respite day is taking all of those extra hours that you've worked and taking it for yourself. I want you to leave at 11 o'clock in the morning and go to the park or do what you need to do. So we are trying to do that as much as possible. We do have assistant nurse managers on each one of our units, which does help support, but it's still not enough. And we have clinical nurse educators for most of our on most of our units at varying FTE levels to also create support. But we're trying to take the work that they don't need to do off their plates. We are also in the process of doing a span of control evaluation using the Ottawa tool. We're using the Ottawa tool because we want to get a baseline to decide where we want to be, because honestly, a nurse manager with 100 FTE direct reports probably needs an awful lot more support than somebody has 60. And so just trying to level that out. Trying to also be very, very grateful every day they walk through the door.
Yep. Yep. There are a few questions that have come in about the recording. Just want to repeat, the webinar recording will be shared shortly by a member of the Incredible Health team reaching out to you directly. So you'll definitely get the recording. One last question, Mel, and like what advice or tips do you have for nursing leaders across the country that are trying to manage this difficult situation or difficult time? What are your top tips?
Take care of yourself.
Yep.
If you don't take care of yourself, you're not going to be there for your team. And that's really, really, really hard. Trust me, I know. But I also know that our leaders look to us to give them signals for what's okay to do and what's not okay to do. So don't send emails after 5 o'clock to your team. And then that lets them know and everybody else know that you won't be answering emails after 5 o'clock or whatever your time limit is. I think you have to be really authentic and transparent with your team. It's okay to say none of us have done this before. So we're all learning this together, and tell me what thoughts you have. I think we have to be very honest and transparent with where we're at in our environment, what we can do and what we can't do. Sometimes it's sitting shoulder to shoulder. I've functioned as a one-to-one sitter a couple of times in the last few weeks for a couple of hours to give the team a break to do other things that they needed to do. Impossible to do every day, not a reasonable expectation, but what that communicates to the team is I'm willing to do what I'm asking you to do. Being out there, management by wandering around. This is hard. None of us know how to do this, and be gentle with yourself and be forgiving, because none of us are perfect in this and we all struggle. And I think it's really important that we allow ourselves to be vulnerable with our teams.
Got it. All right. Thank you so much for your time, Mel, and for sharing your tips, your advice, your tactics, your strategies. This is really, really helpful. And to everyone on the call, I mean, I think my team has shared if you wanted to sign up for a demo or wanted to connect with our team. And then a member of our team will also be in touch with everybody who's registered and attended with the recording. And just thank you everybody for joining and for signing up. We have a couple more, webinars coming up in the coming weeks with, Mel's counterparts in other parts of the country. And just, thank you again, Mel. Really appreciate it.
My pleasure.
All right. Thanks, everybody.